I'm the team leader for the chronic disease management team, and as part of that team we have 3 nurses who run a heart failure service. Our role is to look after patients in the community and improve their condition around heart failure and understanding of the condition, and teach them self-management. One of the main things we have done is start up nurse-led clinics closer to people's homes, and this includes places like community hospitals, day centres, and we've set up 1 clinic in a GP practice. Over the last 5 months we've got together as a team and we've started a baseline audit to see where we are now, as the team has actually been going for 2.5 years, and we want to review where our baseline is at the present time. Our real successes have been reducing admissions to hospital by 23% and improving medicines management by up to 96% according to evidence-based guidelines. The staff team, in particular our team, has responded really well. We've got together really quickly and have looked at what's needed around the 1,000 Lives campaign. I don't think the LHB as a whole have had enough information yet, but our plan is to talk about the 1,000 Lives campaign at the next team meeting. The lessons that we've learned, the main one I think is about communication, about making sure we communicate with all the other teams that are already out there and doing similar work but not quite the same, but also have to be involved in the care of the patient so we all focus on improving patient care. The next steps for us is to review our baseline assessment and look at what the gaps are and work with those gaps that we haven't looked at yet. One of them in particular I think may be around discharge planning. As a community team we don't tend to go into the hospital to get the referrals and they're sent to us, so I think there may be a gap in that area. The one thing that stands out for me is getting to know other people and what they're actually doing in all the other areas, and listening to people in teleconferencing and getting ideas off them. One in particular recently was about having coffee mornings to get patient stories, and we thought that was an excellent idea, so we're hoping to do that in the next few months. We've had some very good positive feedback from patients. They like that we go out to see them and take things closer to the home, and they like the fact that they see the same person every time, so there's continuity of care. And we've also had good feedback from carers who feel that when the diagnosis is made, they get very afraid of the diagnosis, and we can give them a lot of information that makes them understand the condition better and cope with everything that's going to happen. I believe the 1,000 Lives campaign is so important because it puts the patient as the focus of care, and I think all clinicians work towards that aim of making things as good as possible for patients.